Thank you, everybody, for being patient with us. Rules was late getting out, and also working out and making sure that we've got okay bills at the last minute rather than moving forward without checking on that. I'm going to go ahead and call Chairman Jaspers first. I think there may be more discussion on the other bill we have on the agenda. So Representative Jaspers.
Thank you, Madam Chairman and committee. First off, before I get started, I just have a question for Madam Chairman. How many texts and phone calls do you get on a day like today in the last 2 days? I was just
Hundreds.
I would think so, and I appreciate you working with us on this, and appreciate Betsy's quick action, on House Bill 653 that you have before you. This is a patient-focused bill that will ensure Georgians have access to COVID testing after the national state of emergency is over by pharmacists. Everyone has been all hands on deck, during our healthcare needs and to making sure that Georgians have great care. I've lost my track here. Okay, what this bill really does is about testing only, and authorize the pharmacists to continue testing for COVID-19 12 months after the national state of emergency is over, and also administer serology testing, commonly called antibody testing, for those 12 months. Madam Chair, I think the 12-month serology is okay, because antibody testing will be probably over the counter within that 12 months, the way I understand it. Committee, I hope you can vote for this. Both the pharmacy and the physicians groups have worked with me and Chair Lady Cooper on this language. That's it. Thank you.
And I have your commitment that should somebody put something else on this bill, you will not allow it to go forward.
I've had bills, Madam Chairman, before, and she knows she can trust me.
That's right. Okay. Thank you very much, because it's a worked out compromise. Because hopefully after COVID, we're going to try to move our patients back. Not that there's anything wrong with the pharmacists, but people need to go back to their, when possible, to their medical home and be seen for conditions, even like an occasional COVID that pops up by their physician. Especially since I think the most vulnerable people, after we get the largest portion of the population immunized, will be our people with multiple conditions that will make them either sicker, and more important, that they follow with their physician. So thank you very much for that. Okay, questions from the committee? Okay. No, okay. Our virtual members don't have a copy of the bill, so we're going to have to be working to get it to them. We're going to discuss the bill, and they can ask questions if they want to, and then we will get a copy of the bill to them virtually. We'll have to hold off on the vote. Questions, anybody from the committee? Okay, we have one.
Yes, I am afeared that I am about to show my ignorance here, but for the light of instruction of the less learned members of the committee, can you tell us, so from the comments, this is unusual currently that we get tested at a pharmacy. And this is the main reason for the bill, because under state of emergency, we were able to do this. Is that correct?
Just to ask that the state of emergency allowed to increase patient care, patient access.
Okay, very good. I just wanted to be clear. Thank you.
That would be like giving them also where they can give vaccines. And I will say the pharmacies, I mean, I talked about it in the other, we've had a little of a problem between the pharmacies and the doctor's offices. And it's not, I think it's public health. The physicians have seriously ill people. They have wanted to get the vaccines. Most of the vaccines have gone to the pharmacies. And a lot of the people who have very serious illnesses don't want a pharmacist. They want to get the vaccine from their physician that's following them. So and physicians have not been able to get much of the vaccine. So it's a little bit of a problem in this pandemic and trying to get as many people vaccinated as possible. These are the kinds of hiccups that you run into. And so, hopefully when there's more vaccine available, which apparently it's coming, then that will be a problem that takes care of itself. So that gets it. Okay. Other questions from the committee? Anybody online wants to talk? Okay. All right. We have two people want to speak on the bill. Greg Rybel.
Thank you, Madam Chair, and I'll be brief. Would like to thank you and Representative Jaspers and the Medical Association for working with us on this. Once the federal emergency was declared at the federal level, U.S. Department of Health and Human Services authored or provided authority for pharmacists to provide COVID testing, and they've been doing so since that authority was issued. And so, again, what this bill looks to do is ensure that patients, particularly asymptomatic patients, are able to have access to testing quickly and efficiently. And so Pharmacy Association is absolutely in support of the bill and very appreciative of everybody for their time and effort in working on this. Thank you.
Okay, thank you. I don't want to take away pharmacists' job in the 12 months, but I hope we get enough people vaccinated that there very few are going to be coming in to see whether they have COVID-19 or not. So we should be so lucky to get that many people vaccinated in that period of time. I think we're at a little over 1 million people in Georgia, 1,200,000, 1,300,000, and we have 11 million citizens and 330 something million in the country. We've got a long ways to go on that. Okay, Bethany Scherer.
Bethany Scherer with the Medical Association of Georgia. I want to thank Chairman Cooper, Representative Jaspers, and the Pharmacy Association for working with us on this legislation. We certainly understand the need for access to testing. And like Chairman Cooper said, we would like to get patients back into the medical home. There's been some interruption in care. I am sure that you have all seen lots of reports on some of the interruptions that have happened, especially in terms of primary care, especially early on in the pandemic. And so getting patients back into their primary care offices so that we can sort of take care of those ongoing needs and work on preventative measures and preventative health care is ideal. And so we think this legislation does a good job of balancing both of those needs. So, thank you.
Thank you. Okay, people online, have you had time? Can you let us know if you've had time to look at the bill? Are we communicating with them? Can you hear us? Okay, we're getting, see if we can get them. Okay, modern technology. Okay, we're gonna.
Yes, they confirmed.
They confirmed and they've seen it. Okay, great, and they can hear us. Okay, what is the will of the committee? Representative Newton.
Do pass.
Okay, we have a do pass in a second. Did I hear a second?
Yes.
Okay, and is there further discussion from the committee? Anybody? Nope. Okay, so everyone in the favor of the passage of the substitute to House Bill 653, that's LC 33875S, say aye.
Aye.
Anyone opposed? No. Okay. We lose Chairman Jaspers? Okay, all right. Okay, you've got it. There we go. Okay, Representative LaHood to present House Bill 627.
Thanks, Madam Chair, for hearing the bill today, and thanks committee members for being here. I know there's a lot going on today leading up to crossover. So House Bill 627 is a bill that athletic trainers are asking for, and I'm gonna try to explain why. There's 4 sections to the bill, and I'll go ahead and just get it out there. The Section 1 is the section that there might be some concern from some groups. The other sections are pretty easy, and I haven't heard from any stakeholder with any problems. This is a sub. We're looking at LC 338739S. And it's a sub because the Secretary of State had a suggestion on line 43. We added the language to approve a certification examination. And everybody, all the stakeholders are fine with that language. So I'll go back to section 1. What section 1 is dealing with is a change to the definition of athletic injury. Athletic injury means any condition sustained by a person as a result of such person's participation in activities requiring physical strength, agility, flexibility, range of motion, speed, or stamina without respect to where or how the condition occurs. And so the reason for this change being requested is for clarity. Athletic trainers now are or there's some confusion rather on whether they're restricted from treating a condition based on the setting it occurred in, or the activity that caused the condition. In other words, if it happened on a football field, for example, versus if it happened with you walking up the stairs in your house. If you twist your knee or ankle, the resulting condition is the same, but where it happened is different. And so that's what they're after here. They're wanting to be able to treat conditions as appropriate, is deemed by a physician, because a physician still will have to write an order for the condition to be treated by the athletic trainer. So the physician will be the gatekeeper like they are now. So I'm hoping that will, ease any concerns that people have. There are some people that wish to speak, Madam Chair, and maybe we should take questions first, or whatever you think we should do.
Well, I have a question first that I didn't have a chance to talk to you about. On lines 25, you've struck, starting on line 25 and going through 28. Nothing in this code section shall be construed to require licensure of elementary or secondary school teachers, coaches, or authorized volunteers who do not hold themselves out to be to the public as athletic trainers. By striking that means, are they going to be required to get a license?
Okay, so the reason for that change is because the majority of complaints received by the Georgia Board of Athletic Trainers are from the secondary school setting. This eliminated wording removes a loophole to prevent unlicensed practice without stopping anyone from acting as a good Samaritan.
Okay, so in essence, it would make them need to be licensed.
If they're going to do more than what's covered under the Good Samaritan law, like just render first aid.
Right. Okay. I just want to be clear. I'm not disagreeing or, agreeing
Right.
with you. Okay. Representative Bennett.
Thank you, Madam Chair, and thank you, colleague. I'm going to first follow up, Madam Chair, with your question
Okay.
regarding school trainers. Would this, from the lines that Madam Chair referenced, would this preclude the coaches and the athletic trainers and a sports team from applying ice or wrapping or taping or even implementing standard straight stretching exercises of the sort?
Now, you said in your question, you referenced athletic trainer. So if they are a licensed or certified athletic trainer, no, it does not exclude them from doing these things.
Let me clarify then.
Okay.
In school, K through 12 and higher ed, there's generally someone working with the athletic teams when they're on the field and when they're not. So please forgive me if I don't know what they are referred to.
Certainly.
Now, when I was coming to school, they were referred to as a trainer. So, but that was quite some time ago, longer than what I care to remember.
Right. So I do believe there might be some people referring to themselves as trainers, And that's one of the things this bill seeks to do is to make sure it's easy to distinguish who's an actual licensed athletic trainer and who's not.
So the second part, may I continue? So the second part of it is, does this bill then, by striking that, preclude people working with sports teams in a school from applying ice, bandaging, wrapping, taping, crutches, crutch training, exercises?
Okay, so you included a lot of different types of treatments. And it's my understanding that applying ice would not be excluded from, a parent on the sideline or a lay person. But if you go much further where, you're wrapping a joint, excuse me, and some of those other treatments you mentioned, I think you might be correct. We do have some people that can speak to that. We have someone from the Georgia Board of Athletic Trainers and someone from the Georgia Athletic Association that will speak and that can clarify that.
It would be great if we had someone from the high schools to talk about what commonly goes on in little leagues and what have you. My other
Excuse me, just a minute. Did you talk with anybody from the schools that in these positions that you're striking? Did anybody come forward? Of course, it's,
This language came from the Georgia, was recommended by the Georgia Board of Athletic Trainers. And, it's my understanding that does imply that there's been lots of conversations but I think when we hear from them, it'll clear some of these questions up.
okay,
I have not heard from anyone at the schools, no.
okay. Representative
Thank
Bennett.
you, Madam Chair. And then my other question is, can you define for me the difference between an injury and a condition? You used the word condition.
This is on line 12.
Mhm.
Yes,
And so
15 and
the
12.
reason for that change from striking injury and going to condition is because, and again, some of the presenters might be able to explain this better than me, but it's my understanding that the reason for that change is because an injury could occur, 10 years ago or sometime in the past, but the condition remains. The result of the injury could cause a chronic condition. And the treatment for that condition, a lot of times is the same, whether it's an acute situation that it just happened or whether it's something that's months or years later. And so the key part of Section 1 to me is that the physician still has to write an order for the patient to be treated by an athletic trainer. So if the physician doesn't feel like that condition can be treated by an athletic trainer with their level of education and skill, then that physician is not going to write the order.
Last point, Madam Chair, and you're speaking to the physician over there. My question again, thank you, colleague. My question again was the definition between an injury and a condition.
Mhm.
And in medical language, there's a distinct difference. So
Okay.
would you like to tell us what in your opinion, the difference between an injury and a condition?
I will try. I am a registered nurse, so I do have some medical background. Not a lot of experience with acute settings. So I'll try to think of an example. If in an athletic setting, a student athlete starts to vomit on the field, that could be a result of heat exhaustion, or they could have a virus, a stomach virus. But at the time, it's unknown. And so the immediate treatment might be hydration and, a Gatorade and, check vital signs and things like that. But then the ongoing treatment might be different. I don't know if that helps answer the question at all, but injury is typically refers to an acute situation, I believe, and condition could be something that lasts longer or as a result of an injury. But a lot of times the treatment is the same regardless. And that's why, it's up to the physician to decide the appropriate treatment.
Question. Representative Newton.
Yes, thank you. I guess you kind of touched on it, I guess, like we had talked about before, a heat-related nausea could be food poisoning, and it could be something else. So that would be a condition. The other one I had thought of was asthma. And I know you said there's a physical therapist or someone with the athletic trainers. I guess I don't even know their background enough. Do they keep a stethoscope, blood pressure cuff, and things like that? I'm not sure. You mentioned vital signs, which you as a nurse understand, but I guess maybe when you have somebody here, they could clarify a little better on what their background and training, because those are the two I could think of that would be a condition and not an injury, would be an asthma attack. But I don't know if they listen to lungs for wheezing or pulse oximeter. I'm not sure what all athletic trainers' capabilities are. So if
Right.
you or your presenter could help. I'd
Yeah, I think
appreciate
the
it.
presenter will help clear that up. Another thought that just came to mind, if we're talking about an athletic setting during a practice or a game or anything like that, if the student's having any kind of distress, whether it's from an asthma attack or from an ankle sprain, like an injury, I think if that was my child or me on the field, I would want the most qualified person there to come to the rescue and to render care. So good question, good point. And when it's at the appropriate time, we'll get those presenters to address those issues.
Representative Bennett, you have another question?
No, I just want to follow up with the doctor's example of conditions to expand it in medical language. A condition could be multiple sclerosis, muscular dystrophy, lupus, fractures, spinal bifida, congenital abnormalities, Marfan syndrome, club feet, developmental delays, generalized weakness from COVID. Those are considered conditions. And I can go on and on, but I was
Right.
just giving some examples.
I think what we need to do is go to line 14, where it says, as a result of person's participation in activities requiring physical strength, agility, flexibility, range of motion, speed, or stamina, without respect to where or how the condition occurred. I think that's the clarifying language.
Since Madam Chair has left the mic, I'm going to jump in
Go ahead. Fine with me.
and say that as we are having more and more of our young athletes die on the field, unfortunately, there has been one recently in Gwinnett County, which I represent. The activities requiring the physical strength and agility sometimes can be mimicked by some underlying predisposing conditions.
Right. And if the athletic trainer is the most qualified person there, I suppose they would be the ones to render the immediate attention. But outside of the acute injury, if that patient follows up with their physician and the physician says, this athletic trainer, can help you with your recovery, then that's that physician's decision to make. And the physician does that now. The physician that today, decides when one of their patients, when it's appropriate for them to go see an athletic trainer versus some other discipline. And that's not changing.
Okay, Representative, that's the last question that I'm seeing from members. Oh, okay, Representative
You have to wave when you weigh down here.
Representative Jaspers.
Just
Sure.
just a quick question. I think your next speaker, I think is real important here. So I guess this is an issue with some enforcement issue by the board.
Exactly.
I would wish that you would explain the issue to us so we can better understand what we're really trying to do here.
All right. So there's, like I mentioned earlier to your question, Representative Bennett, when it comes to in the authorities enforcing the practice without a license, there's some different interpretations with the current definition. And I think I'm answering your question, but so some reasonable minds would take the language on line 13 that has been struck. That says, participation in exercises, sports, games, or recreational activities. And then there's the or at the end of line 13, and it goes into line 14, activities requiring physical strength, agility, flexibility, range of motion, and so on. And so when it comes to enforcement, the language on either side of that or has caused confusion and different interpretations. And so that's the reason for striking that. And on the injury versus condition language, we're just trying to clear up that the condition didn't necessarily happen at a certain place or setting, but it just happened. And the resulting condition still fits into the description on line 14.
So in other words, a physical therapist, no, an athletic trainer could work in a doctor's office and do this kind of things in the doctor's office. Since you're saying that it's not, you're saying that it's not the place where it happened, like on a sports field, but
Right. I
so
suppose
the
if the-
doctor could hire a athletic trainer to work with an orthopedist could hire an athletic trainer to work with his patients,
I believe that's true.
opening it up.
Yep.
Okay.
That's just a little bit, so make sure I understand. I think I've got it now. That in line 13, you're taking out those definitions, which I would essentially say are school activities in a PE situation or in a, exercises, sports, games. And then on 25, taking the teachers out, or am I missing it? So that really it's just affecting an athletic trainer, not teachers or coaches or a volunteer.
Well, no, in one aspect, if you don't mind me
Yes, ma'am,
answering.
please.
And the first part, you're expanding the places where they can practice. And in the second part, you're restricting other groups that might do flexibility and range of motion.
Okay.
So one is expanding, one is restricting
Right.
or eliminating.
And I've heard from, I've talked with folks at the Secretary of State's office who oversee the board of athletic trainers, and then also the Attorney General's office. I've spoken with them, and they acknowledge that there are enforcement issues at times because of the existing language. They didn't want to get into the policy discussion,
Right.
but they do acknowledge that there are different interpretations that can be made. And it's not always clear on whether somebody's practicing without a license or not, depending on how you interpret these definitions.
Did they propose any language?
Well, the Georgia Board of Athletic Trainers has.
But not the Attorney General's office.
Correct.
Okay.
They didn't want to go that far.
So helpful in such situations like that. Okay. I think that's this. We're finding, okay, we're going to go to the people who want to speak on it right now. if
Okay,
you'll
great.
close that. Because there's no further
Yeah,
questions from the
and
committee.
there's some people here in person and there's some virtually that would like to speak.
We will get them. Paul Higgs. Okay, online, Mr. Higgs. If you'll identify yourself and tell us who you're with.
Yes, ma'am. Chairman Cooper, appreciate the time to address the committee and to give us a chance to speak about the bill. Appreciate your time. My name is Paul Higgs. I am a licensed athletic trainer in Georgia for just over 30 years now. Worked in a multitude of settings from college to high school to now I'm teaching, and also have a clinic on the campus of Valdosta State University, that an outpatient rehab center. And we were approached by the board, basically saying that there was some language that was problematic or conflicting, and it made it hard for them to discipline unlicensed practice or to act on some of the complaints they have. And primarily that definition of athletic injury was the sticking point for them. And in our understanding and discussions with them, that line 13 kind of is very specific, setting based, where line 15, without respect to where or how the injury or condition occurs, is very broad. So you have a very restrictive and a very broad statement to define the same thing. And that's conflicting, and we don't like opposites in the same definition. So removing that setting idea of exercise, sports, games, or recreational activities more clarifies what we're doing. It won't change scope. It doesn't change what we're doing, because we can already treat things that occur regardless of where or how the condition occurs. So we're taking out that restrictive thing, identifying that no other healthcare profession is limited by setting, geographic setting of where it occurs. An ankle sprain in a quarterback and an ankle sprain in the quarterback walking back to his car after practice are the same thing. Ankle sprain in an assembly line worker or in a fireman running, doing their job, it's still an ankle sprain would be appropriate for us to do. We're keeping physician supervision. So anything that gets to an athletic trainer would still be screened and pass through the judgment of a physician in Georgia. We're not acting on our own. And we're not looking to limit anyone doing first aid or Good Samaritan activities. But if they're going to make return to play decisions or rehab recommendations or put a name on a condition, you have a sprained ankle of this ligament and this is what you need to do, we feel that person should have a license to do so in whatever field they're in. And so the parts in the later lines 25 through 28 is not to limit first aid, not to limit Good Samaritan. And some of those condition or procedures you mentioned, like crutch fitting, taping, wrapping, bracing, rehab exercises, those are the jobs that the athletic trainer is doing now and should be doing. It should not be by someone who is not licensed or trained to do it. So we're just closing that loophole where any well-intentioned person might drop in to help, but may not be trained to do it. And that's a much safer way to do it if you have a trained and licensed person available. So we're not taking it away from teachers. We're just saying if you're going to do more than teach or coach and move into any kind of medical decision-making, you should probably have a license. You need to have a license. And if you're doing those things identified with athletic training, it needs to be an athletic training license.
Thank you. We have lots of people who want to speak, so everybody will try to be succinct. But I do have a question. In the rehabilitation clinic that you run, is it overseen by a physician?
Each patient is referred to me by an order. And so each patient would basically have their supervising physician. So you could, in a sense, have two patients with the same condition seen by me, and I would follow one protocol from one physician and one protocol from the other. So everything we do is supervised and referred by physician.
Okay, thank you. And okay, has the physician seen the patient before they
They
refer
could,
him
yes.
out?
Sometimes we may have a standing order or protocol, but there is still that supervision.
Okay, thank you.
Can I ask the presenter a question?
Yes.
Mr. Higgs, if the current definition, if I understand right, has been in place for at least 12 years.
Yes.
And if a physician today wanted to send you a patient who had a condition because they had a stroke, for example, is that legal today? Could a physician send you a patient who had right-sided weakness because of a stroke? And if that might not be the best way to ask the question, but has that ever happened? Has anything
No.
like that ever happened with this current definition?
No, no, sir. And the physicians know how we're trained. We know how we're trained. That the job of the professional to say this is something I can do or not. If they just said, you're not treating the stroke, you need to do something else, address this, maybe that happens, but it should not happen that way. We would be dealing with activity-related conditions, not spina bifida, not MS, not stroke, not Parkinson's. Those are not activity-related conditions.
Right. And so the point I was trying to make is, there is some broad language in the current definition, but it's not being used inappropriately because the
Correct.
physician is the one who writes the order.
Yes.
Well, but going from injury to condition does broaden it, even though the physician's still writing the order. Okay, Representative Newton.
Thank you, Madam Chair. I guess you mentioned those lines 25 through 27. which currently say nothing in this code section shall be construed to require licensure. I assume when you strike that out on purpose, you're meaning to go the other way, which is we kind of want this code section, even for someone who doesn't hold themselves out to the public as an athletic trainer. But if they're going to do any of this stuff, we want them to get licensed and stop doing it. And as Madam Chair mentioned, I don't know if we've heard from the high schools yet. I don't know if that's a problem or common, but I was thinking that was just related to the change in the definition in the beginning, but I see that's kind of a separate specific goal of the legislation is basically to require licensure, even if they don't hold themselves out as an athletic trainer, maybe.
I can address that. We've checked with our members and multiple members throughout the secondary school settings, and we're not going to require anything additional of teachers who are only doing teaching and coaching duties. If anyone decides to add these responsibilities to their job description, then we think they should have a license in that area to do these things. So we're not requiring more. We're just saying those who are not licensed should not be doing these things.
Well, I beg to differ with you. In your eyes, you may not be doing more, but this does move further. Because it takes away from other people, or even if you say it's only things, it does put them then vulnerable to a complaint that they are practicing without a license. Representative Sharper.
Thank you, Madam Chair. Thank you for, I'm seeing this bill in 4 different sections, and I don't know if that's the intent of this, but I'm seeing parts of it of who can do what and what they're already doing. Most of the time, middle schools, high schools, I've seen where they have a medical director, that kind of a doctor that says, okay, this is the problem. This person needs to go to the hospital, or this person needs to be with an athletic trainer. I'm wondering, is there a problem right now of maybe non-athletic people being referred to athletic trainers? Is that a problem right now? I mean,
When you say non-athletic people, you mean people outside of an athletic setting?
Right,
Who may
whether
have
it's the
developed
students
a
or the
condition or
players.
had an injury?
right. Is there something out there like that happening that I'm missing, or is that a problem right now? Can anybody answer that?
I think he did answer it, Representative Sharper because he said that there had been complaints, right, to the board about they couldn't know who to, I hate to use the word punish, but, or because there's an ambiguity, they felt like in the law, so they couldn't handle complaints about people doing things that they shouldn't be doing.
So we're saying if you had just something happen to me and I'm not in sports or anything, that there's a personal physician that's saying instead of going to a physical therapist, to go to this athletic trainer. Is that happening at all?
Well, the physician decides, where the patient can be best treated. I've talked to orthopedic groups and physicians that are in our area, Representative Sharper, and they are fine with this bill. And they said, as a matter of fact, they quite frequently refer patients to, Mr. Higgs' clinic at VSU. And a lot of times it's patients who Mr. Higgs can clarify, but it's patients who, the condition is appropriate for what he can do for them. And then also sometimes it's people who, can't afford the higher cost of going to a physical therapist.
Okay, Representative, we're going to have to move on. We've got about 8 minutes. We're going to probably make the next education group back up. Oh, Chairman Jaspers. Oh, you don't have education anymore, do you? Okay, all right. Okay, but if I want to let everybody that's here that wants to speak but you need to be succinct. Mr. Hoff, online, please be very succinct. Tell us who you are and whether you're for or against this, and briefly, why.
Oh, thank you for having me. I was given the charge by the board to reach out to the state association with some identified language issues that we have in making decisions on complaints and interpreting the law. And that first section was one of the ones that when I reached out and notified the association that this was one of the ones that was conflicting, and we would get conflicting information from our representative from the Attorney General's office in our executive sessions, which made it difficult for us to take action on lots of different things that would come in front of us as a board. So that was just a point of clarification that we just brought to their attention, that if you are interested in opening up your legislation, this is an area that needs attention that would help us administer and provide safety for the public in the state of Georgia as
Thank you.
that came forward.
Okay, and you're an athletic trainer on the board of athletic trainers.
Yes, ma'am.
Thank you very much.
I'm sorry, I'm the chair of the State Board of Athletic Trainers.
Got it. Okay, thank you for your testimony. Eileen DeoGraces.
Hello, I'm Irma Alvarado. Eileen DeoGracias is an occupational therapist who couldn't be here today, but I represent the Georgia Occupational Therapy Association, and we're opposed to House Bill 627 in its current form. And as you said, Madam Chairman, in the first part, expanding the definition, in the second part, actually broadening, restricting, other groups such as occupational therapists. Our lobbyist, Tom Bauer, will be happy to speak with anyone to work on the language. Thank you.
Thank you very much. Daniel Dale, online.
Good afternoon, and thank you, Madam Chair and esteemed members of the committee. My name is Daniel Dale. I'm a doctor of physical therapy and a licensed physical therapist, and I'm also the president of the American Physical Therapy Association of Georgia, or APTA Georgia. And we're appreciative of the efforts of the Georgia Athletic Trainers Association and their government affairs chair, Mr. Paul Higgs. However, we also oppose language in the bill specifically related to section 1 and lines 12 through 15. As Representative Bennett mentioned in some of her comments, changing from injury to condition. Condition typically could be defined as a usually defective state of health, where injury could be defined as hurt, damage, or loss sustained. Some of the conditions that Representative Bennett mentioned would be included as part of this, such as things as post-intensive care syndrome, dementia, multiple sclerosis, cerebral palsy, peripheral neuropathy, or other common medical conditions. I believe that it's treatment that may not be in line with the current state of athletic training, education, or scope of practice based on their licensure. We feel that a change to the word condition would expand the scope to virtually all populations, as we look at the list of activities could be included for anything such as breathing, getting out of bed, or movement throughout the community. We feel that this change moves beyond the understandable term of athletic injury and would significantly blur the line. We're also under the impression from the state board response from the athletic trainer state board is that this would clarify scope of practice and enhance their ability to discipline unlicensed practice. While we don't argue that in sections 2 through 4, in section 1, we feel that this actually significantly increases the scope and decreases the clarity of the law, making it much harder for the state board to enforce disciplinary actions.
Okay.
In a quick view of looking at state board practice acts for athletic training in some of our surrounding states, Alabama continues to define athletic injury as an injury. Mississippi defines it as athletic injury and injury prevention. North Carolina defines it as an athletic injury. South Carolina defines it as an athletic injury with an athletic training practice. He defines it as an injury sustained by a person. So as we look at those, we wonder.
Okay, can I interrupt? Because we're really on a short timeline.
Absolutely, Madam Chair.
We have a couple of questions for you, and so you need to be really succinct.
Thank you, Madam Chair.
Representative Fry.
Thank you, Madam Chair, members of the committee. I think that one of the things that I would like clarified by whoever can answer is the level of training necessary for an athletic trainer versus a physical therapist that we've been talking about. I think Mr. Dale kind of addressed that. And then the other, if we have time, just a real quick exact story that, so I can get my head around what the problem is we're trying to solve here. So
Thank you, Representative Fry. Can you just hold that for a minute? And
absolutely. Yes, ma'am.
Representative
Yes, ma'am.
Hutchins, just hang on.
Okay, my question is the same as Representative Fry's.
Okay, thank you. Okay, Aubrey Vines.
Thank you, Madam Chair. Members of the committee, I'm Aubrey Valines of the Georgia Chiropractic Association. we neither support or oppose this right now. I want to point out a couple of things very quickly. We agree with your interpretation of striking that language, whereas Chairman Newton's, that it would require a license for them. And we would point out that even though you've changed conditions on line 12, page 1, the first one, you haven't changed injury, the first injury, and you haven't changed it on the second page in line 22. It's our understanding, and again, we're not opposing it. We want to point it out that some of the activities that now would then take place that they could treat for conditions would be driving a car, cleaning the house, mowing grass, gardening, chopping wood, assembly, as the gentleman said, or line, and injuries at work. If any of those injuries or condition arose out of that, they'd be able to treat it under the advice and consent of the physician. Thank you very much.
Thank you. Representative, Ms. Sheriff, Bethany. About ready to make you a representative.
We're in a similar position than Bethany Share with Medical Association of Georgia. We're in a similar position as the Chiropractic Association. We're not saying we support or oppose this bill, but we do want to make sure that we're taking special consideration to make sure as we look at expanding the scope of what may be treated by an athletic trainer, that everyone understands differences in education and training between different groups of people, and also that we're I heard some conversation about sort of physician protocol agreements, making sure that we're having specific conversations between that patient and that physician if they're going to be seeking treatment, because that's sort of what we require for physical therapy. And making sure that we're not bypassing the diagnosing by a physician.
Thank you.
Thank you.
Representative Barr, your light's on.
Yes, ma'am. In the interest of time, and there seems to be a lot of questions, I'd like to make a motion to lay this on the table.
Okay, we have a motion to lay this on the table in a second. Is there discussion by any of our committee members? Anybody online as a member? Okay,
Madam Chair, if I may, do we have time for Mr. Higgs and or Mr. Hoff to respond to the comments that were made by the other presenters?
not really.
Not really.
And if we're going to lay it on the table, if this goes through, they are welcome to come back when we go forward. And in case they don't know, by laying it on the table, the bill is still alive and be ready to take up at one of our first meetings. And if it should be laid on the table, then I think the two of us, Representative, need to be meeting with people on all the different areas where we come up with problems over the summer. Okay, no one's asking to say anything, so we have a motion to lay it on the table and a second. Everyone in favor of the motion to lay the bill on the table, say aye.
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 I'm laughing, Shelley, because yours always comes in very loud and clear. Anyone opposed, say no.
No.
All right. Then let's have a show of hands. Everyone in favor of laying it on the table? Got it? It's on, okay. Everyone opposed to laying it on the table? Representing Parson line. Okay, obviously the ayes have it. I think this is an important issue that needs to be solved. I think you may be getting part of this just because we're at the last minute and there's not time to really delve into it. And I feel like I'm partially responsible because of the bind and other things of not catching the lines on the second page and giving you direction to have somebody talk to me about that. So for that part, I will apologize for my part of maybe delaying this until next session. Thank you, many members, that is on the table. This is the last meeting we'll be having. Thank you very much to the best committee in the Georgia House. Bye.
Thanks, everybody.